Periodontal disease is actually an infectious disease. Periodontal disease is gum disease. It's an infection of the oral cavity of the bones and the gum tissue around the teeth. So it's all the supporting structures we're talking about. So when your teeth bleed or your gums bleed, that's a sign that there's infection going on. It's not to be taken lightly either, because it is infectious. And number two, it can really be a big detriment to your overall health, not just to your teeth. One of the ways that gum disease works is it's primarily caused by bacteria in the mouth. And the bacteria gets in there, and we all know about tooth decay. But same kind of bacteria, or some of the other ones that live in your body, basically they will also eat away at the gums and the bone, the foundation around the teeth. And that's what causes the gums to bleed. People who get bad breath, a lot of times the bad breath isn't something from what they ate, it's actually from the gums that are constantly bleeding underneath their tissue. I have a lot of patients who come in and say, yeah, my gums have always bled. It doesn't bother me. And that's the insidious part about the whole thing, is gum disease doesn't hurt. Now, sometimes it does, but generally when it does, it's in its very aggressive late form. And at that point, generally the teeth, we can't save them. So an analogy I sometimes draw to a patient that tells me, oh, well, you know, my gums bleed, but they don't hurt. So I said, well, what if you were brushing your hair in the morning and all of a sudden there was blood on your hairbrush and your scalp was bleeding? I go, I think the average adult would probably be at the emergency room in about 5 minutes wondering what happened. I said, but if you're brushing your teeth and they bleed and you don't think anything, this isn't internal bleeding, this is external. Internal bleeding affects other organs in your body, your cardiovascular system, things like that. And so with somebody who has bleeding gums, or they think they have gum disease, or have been diagnosed with periodontal disease, one of the first things we tell them is this is affecting your overall health, not just the oral cavity in your teeth. Because there's studies now that show there's possible links with Alzheimer's, diabetes, and all of these other things that can kill you. And so we look at the mouth and we try to get it healthy. Now, the other reason dentists have always looked at it is because if that infection continues, one of the problems is you're going to lose the bone and your teeth are going to get loose and they're going to fall out. And that's the number one reason people lose their teeth. It's generally rare that a person loses their tooth because of a big cavity. Because with technology today, we can almost fix any kind of tooth if it's got the foundation. But if it doesn't have a foundation, all bets are off. It's just like remodeling a house. You can remodel your house, remodel it, but once the foundation's gone, all bets are off. If you suspect you have gum disease, or you suspect, oh, I think I have a problem, the first thing that you need is you need a diagnosis. And you need to see a dentist and have a diagnosis of what's going on, because you want to know what stage the disease is in. Okay? Because there are different kinds of treatments that you can do. Some of it's surgery, and that's scary. Some of it's non-surgical, not as scary. But it really depends on the diagnosis for the patient.